of Republic of Uganda requires the state to take all practical measures to ensure the provision of basic medical services to the population. And whereas the government of Uganda has already put in place similar interventions, specifically a national policy on anti-retrieval therapy, which has developed and subsequently resulted in the provision of free anti-retrieval drugs to people living with HIV or AIDS. Right, Honourable Speaker, aware that the World Health Organization describes diabetes of a chronic disease that occurs either when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. Further aware that insulin is a hormone that regulates blood sugar and is a such blood sugar is a common effect of uncontrolled diabetes and over time leads serious damage of many of the body's systems, especially the nerves and blood vessels. Noting that in Uganda, the burden of non-communicable diseases is steadily rising amid this high prevalence of communicable diseases, stretching the healthcare system, and that 1/3 of non-communicable diseases, mortalities globally, have been attributed to cardiovascular diseases, with about 80% of the cardiovascular diseases related deaths occur in low and middle income countries. And more than half of these deaths are a result of complications of hypertension and diabetes. Further noting that the burden of disease is expected to double for both diabetes and high blood pressure by 2025 to 2035, respectively, and as such, the increase in prevalence of diabetes is especially rapid in Uganda, where the number of people with DM is predicted to increase by 166.9% between 2013 to 2035, outpacing most other countries. Cognizant of the fact that 40% of Ugandan health centers don't stock drugs to treat chronic diseases, and that currently the drugs for diabetes are high and high blood pressure too expensive for the average Ugandan. Right, Honourable Speaker, now therefore be it resolved by this Parliament to urge government to provide free screening and treatment for retinopathy, which causes blindness, free blood lipid control to regulate cholesterol levels, and provide screening for early signs of diabetes, related kidneys, and treatment. Provide free drugs for Ugandans suffering from diabetes and high blood pressure. Honourable Speaker, I beg to move.
Is the motion seconded? Seconded by Tororo Municipality, the Honourable Museveni, member for Kagadi, member for Ngora, member for Gweri, UPDF, workers. Honourable Bakabulindi, would you like to briefly speak to your motion, Madam?
Thank you, Right Honourable Speaker. In this country, if in your family you don't have a patient, if you don't have a relative, a friend, or a neighbor suffering from diabetes, in your village there is one. Medical services in this country are not sufficient enough, and especially in the hard-to-reach districts and rich areas. A number of people in this country are relinquishing in our villages suffering from diabetes. The rate of infection is even higher than HIV. Today, someone who's suffering from HIV or AIDS can live a better life than someone suffering from diabetes or high blood pressure. Last weekend I was in Kanungu. I gave an old woman a ride to the burial. When we reached, immediately she suffered from high blood pressure, and she could not afford medication. So she had to suffer, and she has to live that kind of life. Then the medication is so expensive to the extent that so many people cannot afford in our villages and in our economy. Most of the people are low-income earners, so these kind of medications they require to take every day, suffering from diabetes or the insulin, is very expensive. Right, Honorable Speaker, this is why I urge the government of Uganda, through Ministry of Health, to help Ugandans get free medication or free drugs and early screening to prevent people from dying. When you see many people of this country today are dying from diabetes, the death rate is very high than people suffering from HIV. So I urge this government and I appeal to this government to help poor Ugandans. And if you can look around or ask in these chambers, I think most of these honorable members, they have relatives, neighbors, and people they know who are suffering from diabetes. Diabetes sometimes goes hand in hand with blood pressure, and it ends up giving people cardiovascular disease. And some people are going blind because of this disease. You're right, Honorable Speaker. It would be very nice if this government gives Ugandans free screening and diabetic medication. I beg to move.
Thank you very much, Honorable Member. Seconding the motion, would you like to speak at this moment? The Honorable Apollo Yeri, Ofono, Toro Municipality.
Thank you very much, the Right Honorable Speaker. I here to second this motion. Generally, we have not trained the health workers how to treat the patients with the diabetes and the high blood pressure. So, if it is given free, if the government can give free treatment, then the Ministry of Health will try to train more health workers to handle this complicated disease. So if this motion is taken, it will help the wananchi. There are issues, cost. It is costly and not available. These drugs are costly and not available. So when the Ministry of Health takes over, I think maybe they will make the national medical stores to avail this medicine easily to the population. So it will be very, very good for the population to benefit out of this. But by now, we try even to go to this, we use herbist, we go to these witchcrafts and so on. And, so it does not work. So they should bring a modern machine, test and know what you are suffering from. Let us bring this modern machine, inform people you are suffering from this disease, which can reduce, maybe it may not cure, but it can reduce the what? You can take some time before it takes you. So it is very, very important. So, Honorable Speaker, colleagues, let us support this motion so that, because we have come to live with this disease now, so that we can reduce and help our people. Thank you.
Thank you very much, honorable members. The motion that I now propose for your debate is for a resolution of Parliament urging government to provide free drugs to Ugandans suffering from diabetes and high blood pressure in Uganda. That is the question for your debate, and the debate starts now. We'll start from Bujiri Municipality.
Right Honourable Speaker, I thank you so much for the opportunity and the Honourable colleague for the motion. Right Honourable Speaker, there are many ailments in this country that require attention from government. Certainly diabetes and high blood pressure are an example. But I think that we would be looking at ailments in the country from a broader perspective. For us to provide free health care or health insurance for that matter. The danger of particularizing ailments is that tomorrow we are likely to come up with another ailment and will require a resolution of this parliament to urge government to provide free drugs to that ailment. So I would really think that as a parliament, as a country, let's look at diseases and the health sector in a more broader perspective. Finally, Right Honourable Speaker, in 2019, we were in Burundi with the Parliamentary Sports Club. We found a very good culture in that country. Every morning, everybody is running, physical exercise. Because some of these non-communicable diseases can be avoided either through proper nutrition or good exercise, regular exercise. So as we call on government to provide free medical care, we should also be urging ourselves to develop a culture of eating well and also exercising regularly. Right, Honourable Speaker, as we talk now, the Parliamentary Sports Club is preparing to go to Arusha for the East Africa Games. MPs are not training. We have made calls for people to come and train. They are not training, even if eventually you will not make the list. But at least it's good for your health. But they are not coming. And we will be the ones, again, complaining about these diseases. So some of these issues, as we urge government, we also need to sensitize ourselves and the public on the need to live healthy lives and healthy lifestyles. I thank you, Right Honourable Speaker.
Thank you very much. Can I have Honourable Kabulindi?
Thanks very much, Right Honourable Speaker. And I want to support the motion, and I thank my colleague, my sister, who has brought this motion. Dear honourable members, it may sound as if it is a simple solution, but there are certain diseases that don't warn. And if we take a survey among ourselves here and say, how many of you have high blood pressure? I'm sure some will raise their hands and say, I don't have. But to go for testing is when we will come to know that either you have reached levels which are dangerous or not. The same to diabetes. To me, when we are providing the drugs, the intent is not only to provide the drugs, but also to sensitize the public. My colleague, I do agree with him, who talked about sports. I'm the founder of Parliamentary Football Club here. But even I had some who had pressure. That's not enough solution. It's a supplement. So when we say let government provide drugs, government will not stop on only buying drugs, but will sensitize the population on how to avoid high blood pressure or diabetes. Right Honourable Speaker, these are diseases in the 60s and 50s which were meant for old people, rich people, high-class people. But now you find a small kid in the village, young, less than 15 years, is having high blood pressure or diabetes. What do we do? I think this is the right moment and the right motion that we need to support, so that at the end of the day, we don't regret. Because when diabetes reach a certain level, high blood pressure, then the next alternative is to damage other organs. So to me, if this is done, I really support this motion. I thank you.
Thank you very much. I think we also need to deal with the question raised by the member for Bugiri. Do we leave it at suffering from diabetes and high blood pressure, or should we get a broader term so that we don't have to risk listing, which the word would be non-communicable diseases? It might be more general than two if they are identified. Can I have a member for Lamour, Dr. Okulu?
Thank you very much, Right Honourable Speaker. I would like to thank you for this opportunity. I would also like to thank my colleague for moving the motion on diabetes. Right Honourable Speaker, my colleagues, I'm a practicing medical doctor. This is a very, very, very important topic. Diabetes indeed has ravaged the country, especially people of age or about to go into their retirement. It is a non-communicable disease. It is a preventable disease. I think this House should resolve to take a holistic view of not only curing or treating diabetes. I think we should tackle it from the root, which is prevention. We can go further to even include it in the syllabus so that the awareness about diabetes and other communicable diseases is in the head of every child who grows up from school. I thank you, I thank this House, I thank the mover of the motion and the supporters. I would be glad if this House supports the motion and something is done about it, particularly in a holistic manner. Thank you very much.
Thank you. Loka District.
Thank you so much, Right Honourable Speaker. My name is Esther Mbayo, the Woman Member of Parliament, Loka District. Right Honourable, I want to thank the Honourable colleague for the motion. And just as you said, we should look at non-communicable diseases vis-a-vis the diabetes and pressure alone. I want to join my colleagues, the Honourable Basalira, to emphasize that many Ugandans are dying more of non-communicable diseases than communicable diseases. But this is because of probably failure for the government to do what it's supposed to do. I will not put it on government alone, but it is a concerted effort. Right Honourable Speaker, we've moved around in various communities on the Committee of Health, but we found out that in most communities, there is lack of the equipment to test and detect the early appearance of the non-communicable diseases. Right Honourable Speaker, it is also upon us to sensitize the community, to tell our people the dangers of the non-communicable diseases, and then probably to urge them to continue going for checkups. Because in most cases, somebody realizes that he's suffering from diabetes or high blood pressure or whatever after a long time when it is too late. So the earlier we do it, the better. Let us not only look at diabetes, but let us look at non-communicable diseases in entirety. I want to thank you.
Thank you. Gweri.
Thank you, Mr. Speaker. I also want to support the mover of the motion because I am also a victim. When you are in a family and your mother has diabetes, meaning you are also a victim. I am much aware that diabetes, for you to get those medicines, you have to be in an association where you pay money, that if medicine comes through that association, that is when you will get the medicine. And doctor said it is only the aged who get these diseases. No. There is a girl of 12 years who was also got with this disease in Soroti, and I happened to be one of those who took her for medication, but there were no drugs. I thank you.
Thank you very much. Can I have Ngora District?
Thank you, Right Honourable Speaker. And this is my maiden speech. I want to appreciate the honorable colleague for raising this matter, but I stand to support the voices that are saying we don't limit it to diabetes and high blood pressure. Right Honorable Speaker, the rate of alarm of the non-communicable diseases, including but not limited to cancer, epilepsy, and by this, I also want to extend to the neglected diseases like leprosy, elephantiasis. The alarm is in such a way that it mostly afflicts the poorest of the poor. So, Right Honorable Speaker, I stand to support the motion that we should encourage free screening and treatment. And I suggest that the free screening and treatment must be at the lowest, maybe the lowest health center 3, at the level of health center 3, because this is the health center where the poorest people can reach. And when we put them at the health center 3, they will be encouraged to go for checkups. And right now, our health situation in the country is so appalling. So I stand to support the motion. I thank you, Honorable Speaker.
Thank you very much. Can I have Jonam? Then I come this side.
Thank you, Right Honorable Speaker. I stand to essentially support the motion, but at the same time to agree with my colleagues that it should be widened to include other diseases. As my colleague stated, I agree with the fact that our people need to be educated on some of these diseases, and it is supposed to be done better when we start from childhood. For instance, my mother has high blood pressure, but she doesn't have diabetes. And for her, she can only take the medicine when she's not feeling well. And yet we know the medication for high blood pressure is supposed to be for the rest of your life. But for her, immediately she's feeling well, she will stop the drug, because her belief is that drugs which are supposed to be taken for life are only for AIDS or for HIV. But also, Right Honorable Speaker, this motion brings into light what we have been grappling with as a country for years, and that is the issue of the health insurance policy for the whole country. I wonder where we are on that, because I would imagine under that policy, such people would be covered without us having to discuss it here. It would be automatic that people are supported. And maybe it is also time for us to call whoever is responsible to make sure that we reintroduce that and have it taken as a country. I know that some people may still not want to support that, but it is very important. It may not be you, but another time it can be your relative, and yet if we were in a pool having a source where everybody can draw from, maybe some of the problems would be made easier. So I still feel we need to go back and look at the health insurance policy and have it for our country. Thank you, Right Honorable Speaker.
West Moyo, Gomba West, Pade.
Thank you very much, Mr. Speaker, and my dear colleagues. I'm here to support the motion. We always say prevention is better than cure, and health is wealth. I want to thank the President of the Republic of Uganda, General Yoweri Kaguta Museveni, for being exemplary. He jogs every morning. He does press-ups. What he's trying to do, He is trying to fight non-communicable diseases, cardiovascular diseases, diabetes, hypertension, cardiac arrest, stroke, and so on and so forth. So please, members, as one of the coordinators for the Parliamentary Sports Club and also athletics, may we jog? Can we jog? Can we do some sports so that we avoid some of these cardiovascular diseases? How can we prevent this? Members, balanced diet. Avoid too much intake of alcohol. Let's change our lifestyle. Balanced diet. All this will help us. Otherwise, the move of the motion, thank you very much. We're going to support you. The governments will come in to help those who are already affected. Thank you very much, Mr. Speaker.
Gomba West.
Thank you, Right Honorable Speaker. I rise to support this bill, and mine is really because in the rural setting, many times people come up to die of high blood pressure and they think they have been bewitched, or you just hear, I think, well, the word in Uganda is like, it just broke. It's like chikutuko. It just broke. And so you find people unsure about what has happened. But Tom came up to mention part of what I had wanted to. Prevention is better than cure. Apart from what he mentioned about exercise, we need to reduce our sodium intake. Many times we are told not to eat raw salt, and we ignore it. Drink less alcohol, eat more potassium-free foods, cut back on caffeine, learn to manage stress, and lose weight. I don't know whether I should be the one talking about that, but hey, you can still be healthy even when you're oversized like this. Yeah. So I would like to encourage members to avoid rather than manage the high blood pressure as it comes on. Thank you, Right Honorable.
Bade District.
Thank you, Right Honorable Speaker. Right Honorable Speaker, I rise to support the motion moved by Honorable Patient. This is a very important motion, Right Honorable Speaker. Diabetes is a disease which is too complicated, and pressure is equally very complicated. We have very many diseases which are really affecting Ugandans that we do not know where they've originated from. Right Honorable Speaker, I also support members who said we should not only zero on diabetes and pressure, rather we extend it to other diseases. Right Honorable Speaker, we have a very peculiar disease called nodding disease in northern Uganda, which is equally a very serious disease and torturing very many lives of Uganda. I urge the government to focus and see this with serious concern, because we are having children with their parents who are really suffering. Right Honorable Speaker, when we see diabetes is a disease which is very expensive to treat. And I don't know whether it is a coincidence that every time you go to the government's facility, you will be told to go and buy the drugs from the private clinics, from the private hospital. So, Right Honorable Speaker, I support the motion that we are to support Ugandan to get treatment for these diseases so that we save life. I thank you, Right Honorable Speaker.
Thank you very much. The Honorable Museveni.
Thank you, Right Honorable Speaker. My name is Museveni from Buwekura. Right Honorable Speaker, I stand in support of the motion. And here in Uganda, so many people are dying. And in most cases, we find them claiming it is witchcraft yet it is such diseases. Right Honorable Speaker, we should introduce like compulsory testing for most Ugandans who visit the hospitals, for diabetes especially. At least for blood pressure, it's being done, at least. But for diabetes, it's not done. Another thing, Right Honorable Speaker, I think we should also introduce a national policy on physical fitness like other countries are doing. And because, as said, prevention is better than cure. Information.
Thank you very much, member, for giving me the time for information. Mr. Speaker, in the year 2017, the president physically went to Kololo airstrip and he launched sports activities so that we can avoid these diseases. Thank you very much. That's the information I wanted to give you.
Thank you, Right Honorable colleague. So, Right Honorable Speaker, that would be my great prayer to this House if we can introduce a national policy on physical fitness, and we, the top leaders, being exemplary, doing what we are preaching. I submit.
Can I now have the Honorable Dr. Kano Nekesa?
I thank you, Right Honorable Speaker, for the opportunity to let me say something on procedure. I'm standing here to raise a point of procedure in that we are talking as individuals, as a house, about our levels of fitness, about admiring our head of state for fitness, about the diseases, and even the motion that reads about using funds that may not be enough to cater for free treatment in some of the NCDs, or if not all. My part of procedure is, would it be right that we as a house, a legislative house, think about having policies that will go and trickle down in our country to the lowest community, to upper echelons that can follow up well laid out strategy, well laid out way of doing this in terms of our diety, written down, recorded, and practiced, in terms of fitness as part of our lifestyle, as part of our norms, so that we have this achieved, and looking into the pockets of the country that may not achieve everything that we may be requiring in this NCD issue. Thank you, Chairman. Thank you, Speaker.
Thank you very much. Thank you, Honorable. Can I have the PWD Northern before I come to Honorable Wakabi?
Thank you, Right Honorable Speaker. I also rise to support the motion. Reason being, we are all candidates for diabetes and pressure. As we age, we are all prone to this disease. Right Honorable Speaker, my only concern is that we need to come out with a resolution that should not be open-ended, because other people suffering from other ailments will abuse the service. I thank you.
Thank you very much. Can I now have yes, Honorable Wakabi?
Thank you, Right Honorable Speaker. One, it is true many Ugandans are dying as a result of diabetes. For example, me practically during campaigns, that's why I want to encourage all Ugandans, irrespective of the age, whether young or old, to go for tests, to test for diabetes. During campaigns, I visited many hospitals, but I didn't suspect that I might be having diabetes. They tested for me for malaria and the etc., but I didn't test for diabetes. I almost died. I discovered it later that I had diabetes. They would tell me it is because of campaigns, it is fatigue and what. So I encourage Ugandans to
go for tests. Right Honorable Speaker, I think even the National Drug Authority is not doing its work well, because we have many local drugs on the market, fake drugs on the market. So I appeal to government to really fight fake drugs on the market. Right Honorable Speaker, I also encourage government to do more research on the causes of diabetes, because it is not clear. Other people are saying it is lack of practice, physical practice. But me, I'm a footballer, but I was diagnosed of diabetes. So what is the cause? My parents have no diabetes. So I think we should do, as government, I encourage government to do more research on the causes of diabetes. Is it the increased use of herbicides? Is it the cause? Otherwise, I encourage all Ugandans to go for tests irrespective of the age. I thank you.
Thank you very much. I am still this side, and this side does not include the member for Chigulu. Honorable member for Chigulu is this side. Kitgum? Is that Kitgum? No, Chua. Chua.
Thank you. Thank you very much, Right Honorable Speaker. Mr. Speaker, I rise to second the motion with the reason that, as many people have been saying here, diabetes and high blood pressure moves together. And when we check the people who are always suffering from diabetes and high blood pressures, are always elderly persons who may not be able to have the money to treat. And in that, I'm in support that if really the government of Uganda, Ministry of Health, would stock the medicine for diabetes and pressure. I was a head teacher in some of the schools, in one of the schools in Karamoja in 2004. A child, a young girl of 13 years, fell sick. And when she was taken to the hospital, this is where I go by what my immediate colleague had said. This girl, when she was taken to the hospital, they started giving her, putting her on drip. And what happens, the lady passed on. And later it was discovered at the last moment in maternity hospital that she had diabetes. So I here support the motion and say diabetes does not only affect the elderly and maybe it is hereditary from the parents. Even some people who are young are suffering from diabetes. So I would urge the government of Uganda to take it as key, just that everyone who goes to the hospital would be checked and given the rightful treatment. I beg to submit. Thank you.
Thank you very much. Oyam?
Thank you, Right Honorable Speaker. Right Honorable Speaker, I want also to join colleagues in thanking the mover of this motion. Mr. Speaker, I want to start by saying that we need a national program for the non-communicable diseases. Right Honorable Speaker, when you look at these non-communicable diseases, most of them, according to what I was reading online, are lifestyle diseases, and they are preventable. Meaning that if we have a national program which really spells out how we can deal with these diseases, which spells out the awareness creation, then we shall be able to address this problem from all over the country and from all the categories of the people who are affected by this illness. Mr. Speaker, I also want to bring to the attention of this House that in most of our health facilities, we don't have the specialists who are standby to meet the demand which is out there. I was reading, looking at the motion, it's expected that
it will increase by 166.9 between 2013 and 2035. Right, Honorable Speaker, this is alarming. And indeed, we need to do something as a country, not only to look at the diabetes and hypertension, but all the non-communicable diseases in totality. Finally, I want to support the motion by saying that it's a high time that some of these diseases are very expensive and it affects more, especially the elderly, and the government must come straight on this and provide free drugs and the necessary equipment which is needed. I thank you.
Thank you very much. I'll now have Chigulu South, Agago North, is it? Rute County North, Padiere County, Kapalabiong. Then we'll continue from there.
Yeah, thank you very much, Right Honourable Speaker. Right Honourable Speaker, I rise to support the motion on the floor. Right Honourable Speaker, when we were moving as a parliamentary task force on COVID, one of the key findings, stroke revelations in the field, was stressed that most of the deaths that occurred in most of the health centers, stroke hospitals, had traces, had a record to do with diabetes and high blood pressure. It is against this background, Right Honourable Speaker, that we should interest ourselves as Parliament and as government with the motion moved by the member that it is in good faith. We need to support it wholeheartedly. Honourable Speaker, I also want to request you, as the head of this institution, to capture these on our itinerary, our program for the year. Right Honourable Speaker, we put a lot of attention on cancer as a Parliament. We participate in activities like cancer, Run for Cancer. Then the HIV Health Week of Parliament, we always look at HIV AIDS. Could we also interest ourselves in popularizing how to manage, how to treat, and prevent these diseases? More so having a nationwide campaign in sensitizing our voters. I think if all of us, whoever held a microphone in our constituencies and talked about diabetes, high blood pressure, it could make a difference, it could make a change. Honourable Speaker, last year, out of ignorance, we lost a citizen who was in transit from Kampala to Mbale. But when the blood pressure, I think that is low blood pressure, somebody ran out of pressure, so they parked around Tirinyi Road, junction called Nakalama, asking for some sugar, just sugar, local sugar, to help boost the sugar levels. The mother of these children who are providing sugar kept slapping them. Don't, you'll be arrested for killing someone. Denying the children from giving out sugar that they will be taken up for killing someone. Finally, this person died before getting that immediate attention because of ignorance. It is my humble prayer, sir, that we do a lot of sensitization, mobilization, and popularizing how best we can prevent some of these. Thank you so much, Honourable Speaker. I support the motion.
Agago.
Thank you, Mr. Speaker, and the mover of the motion. I rise to support the motion. Mr. Speaker, in the past, diseases like high blood pressure, the cancer, hepatitis, sickle cells, those diseases were very rare to hear about. But these days, it is in a rapid increment. Then you ask yourself, what could be the causes of all this? One could be environmental factors, which many of us are talking about. In northern Uganda, where I come from, especially the Luo community, men could live for a very long time. But there's another disease which is now even very rapidly in increment, the prostate cancer. And very few people take interest on that. In this motion, I would urge members to include even prostate cancer, especially to men who are above 60 years of age onward. They say 40, for a man when you are 40, there is that problem of enlargement of the prostate gland, which also need us to go to keep checking. For me, normally do checking, it is important for you also to go and do your checking. But it is also more rapid to the people who are above 60 and above, 70 and all that. We have lost very many people to prostate cancer. But in an ideal situation, all government facilities are supposed to be free. When you go to all government facilities, supposed to be free, supposed to get medication, supposed to get all those services on a free basis. But now we ask ourselves, we are advocating so that we should have a free drug for diabetes, hypertension, plus any other disease which is on board. I think we need to strengthen our health facility the more. We have to bring in services which are not there at the health center 3, even health center 2, so that our people can access it. We should talk about the accessibility and availability of those drugs and services. If we can do that, then what we are talking about, including the exercise that we are advocating for, I think we are going to reduce this thing. I support this motion. Besides, when you consider the environmental factor about this, stress is one of the things that causes those things. When you are poor, the poverty level is growing up. People will be so stressful.
No, I have not limited time, so you have just switched yourself off. So no, we have not yet agreed on time, so the member just switched himself off, so we go to a router.
Thank you, the Right Honourable Speaker. I'm Christina Kello, Member of Parliament from Erute North Constituency, Lira District. I rise to support the motion on the reason that we need to act on the preventive measures. They said ignorance is a disease. And what we need to do, remember we had what we call primary health care. We used to educate people on that, but currently it's not happening. I myself happen to be one of the victims during my campaign. We talked of high blood pressure, but we also have the low blood pressure. I suffered from low blood pressure because I've not been taking fluids, enough water. So when I moved, I could find myself getting tired, and I was encouraged to drink enough fluid. But now I'm not on medication. So I'm urging my fellow members of Parliament, take enough water, take enough fluid. It is better to prevent other than going for cure. And also concerning the high blood pressure, it starts from there. Like I have a relative who died who had high blood pressure. Then from there, it caused even kidney failure, and he died of kidney failure. So we need to sensitize the community about the danger of these non-communicable diseases. It is expensive. Like currently, the rural people, it is expensive for them to get medication. But for us in urban center, we can buy. So what I'm urging, there's what we call we need to guard against what we call self-medication. And also the challenge is also caused by some of these clinics, like in the region where I come from, the standard of the clinic, you cannot compare to this one in the central. Some of them are caused by those people at the clinic. They call themselves the doctors, and yet they are not qualified doctors. They prescribe medication which they are not supposed to do, which is not of that standard. So I urge the Ministry of Health, at least you need to monitor, you check on some of those clinics, so that we prevent our people from dying of these diseases. I beg to submit. Thank you.
Padire.
Thank you, Right Honourable Speaker. Isaac Otimgiu, MP Padire County. Mr. Speaker, I stand today in support of the motion raised by my honourable colleague. It is sad that up to today we've taken this long as Parliament to actually recognize the challenges we are facing. if we do not act now, NCDs will create a very big burden in our healthcare system, which is already overstretched. Diseases like diabetes, high blood pressure, those are preventable diseases. And in other words, actually the number of people dying with those type of diseases are not that many, because the governments have come and equipped the health center. We find that people with diabetes in other countries are having the equipment. They are trained to measure their own blood level sugars. We have the VHTs. We've got 2 VHTs in every village in Uganda. Why can we not utilize those people to detect these challenges in the earliest stage? As a member of the health committee of this parliament, I'm happy that 2 weeks ago with my fellow members, we attended the NCD conference organized by the Ministry of Health in Entebbe, and most of these challenges were raised. We can detect these things, these diseases in the most earliest stages. But one of the most forgotten NCD that we're not talking about today is sickle cells. As I moved during my campaign, I was faced by parents having children suffering from this disease of sickle cell. The health centers near them have no blood bank whatsoever. But there's nothing we can do for them. Let us try and recognize some of these NCDs like the sickle cells, and we help these parents who have nothing they can do for their children apart from watch them. So I stand here today and I support this motion wholeheartedly, and I pray that this parliament takes this challenge of NCDs as an important challenge. I beg to submit. Thank you.
Kapelebiong, this is a motion.
Thank you, Mr. Speaker, for allowing me to proceed with my submission. Senator Anthony, my name is from Kapelebiong. First of all, I stand to support the motion of us allocating more resources for high blood pressure or low blood pressure and diabetes. Secondly, I support the views of the members that we should expand this motion to include the various NCDs which are not provided attention adequately, as should be done by government and the Ministry of Health. Thirdly, I suggest that our approach should be comprehensive, combining both prevention and curative, because not one of them alone is enough. As members are arguing, I think let's have a comprehensive approach on how we fight disease. My fourth point is, I wonder whether our argument or our motion is a little bit on the wrong side of the equation. Because our law, as last time I checked, we're supposed to get free medical services and drugs from our health facilities. Now, if we ask for further allocation of free drugs or stocking, we should go beyond the stocking and ask, why don't we have these drugs in our health facilities? One of them I came to discover was the allocation of funds for health or drugs in the districts. The districts get little money, and they are forced to choose between which drugs should they order from national medical stores. And because of the population having a lot of these communicable diseases, they tend to prioritize the communicable ones. And because of that, their resources are forced to focus on those ones. So as Parliament, as we ask government to allocate more, stock more drugs, we should address the underlying cause of adequate provision of funds to the health sector. The last time we were here, I remember we were all rising from various parts to disclose that we didn't have health facilities in our constituencies. And I'll tell you, for example, in Kapelebiong, I have 3 sub-counties out of 4 that don't even have a health center too. A health center to basic infrastructure is not available. Now, beyond that, personnel. We have a staffing challenge of health personnel. And I know when I say Kapelebiong, there are many areas which you can identify with us in this country. You go to a health center 3, you find there may be about 5 or 6 qualified medical workers available. You go to health center too, there's only one person available. And so we need to address the underlying causes of inadequate service delivery by the Ministry of Health to the public out there. Over and above that is the whole question of referral mechanism. When an issue is identified at the lowest level, how do they rise up the levels and get to the health, either center for or to a hospital? We're having a challenge of ambulances, a challenge of fueling. In my constituency, every referral, if the patient can't raise 300,000 shillings to fuel an ambulance and get to the hospital, they die in the village. And so I request that as we address the question of availability of drugs stocking in those health facilities, we need to ask what are the underlying causes? When the drugs are delivered by NMS, another point I want to raise is that within a period of 2 to 3 to 5 days, if you go to almost every health facility in this country, they will tell you we have run out of drugs. And the question is, where are the drugs going? And so as Parliament, I pray through you, Right Honourable Speaker, we should be getting to the bottom causes of this issue so that we can be able to find proper, long-lasting solutions that can help us. Before I sit down, Honourable Speaker, I will oblige your guidance. I'm sorry I came a bit late. I was caught up trying to coordinate some interventions which are urgent in my constituency. There has been a huge deluge of rainfall supported by rains over the last few weeks. As we're talking now about like 5,000 people are displaced from their houses. About 3,180 something homes have either collapsed or at levels of collapsing and can't be inhabitable. The latrines have been filled with water and all the contents are now
Honorable,
up.
Honorable.
So,
you know the rules.
Thank you.
But those who have had.
Thank you.
They should.
Thank you.
And require some action.
Yes.
The honourable member who wants to do an amendment, let's have a debate and I come to you so that you can do your proposed amendments. This is how we are going to proceed from now. I have the Bushenyi district, Aivu, the Honourable Wachikona, Butambala, Masindi district, Ndorwa, and then I come to Manjia.
Thank you, Right Honourable Speaker. My name is Katsime Anet Mujisha, the woman member of Parliament, Bushenyi District. I rise to support the motion, and I want to thank my colleague for moving the motion. Right Honourable Speaker, the illnesses we are talking about are chronic in nature, that when you contract diabetes or high blood pressure, you have to be on medication for the rest of your life. And in my district, some people have actually opted to leave medication because the drugs are very expensive. Right Honourable Speaker, during my interaction with the officials in my district at Eros Center 3 and 4, I ascertained that national medical stores distribute drugs for 2 months, but in actual sense, those drugs last for only 2 weeks. A case in point, I want to agree with the Honourable Basarirwa. We cannot only talk about the diabetes and high blood pressure. Like there is this drug called the anesthetic, they are called anesthetic drugs. They are given to mothers due for cesarean section. They get finished within 2 weeks, and this is a woman who comes ready to give birth, but because of that medicine is lacking, they are referred to other hospitals to get services. Right Honourable Speaker, this has caused congestion and even death because mothers sometimes cannot make it on time. I support the motion, and I ask you, Right Honourable Speaker,
through your chair, let us talk to the national medical stores to supply medicine that will last actually for 2 months. I submit, Right Honourable Speaker.
Aivu.
Thank you so much, Right Honourable Speaker. Feta Geoffrey, Aivu East. I want to thank the mover of the motion and support, because first of all, diabetes and pressure mainly affects our elderly people who have retired and they're in the villages. But the distance they move from the villages to access a health facility is a very big bearing on them, besides the cost. And if they reach there, they don't have the money to treat, it is another burden. This is why I think the mover has brought this very timely. In our villages, where you've had mob justice, sometimes the victims have died of pressure, but the people think this could have been something else, and then they go and attack a suspect, and it is happening. Now, when we reduce the cost of treating diabetes and the blood pressure, we'll be doing the country a lot of service. And we'll also be able to improve a lot of facilities so that the people we want to help can be treated. The VHTs, who play a very key role in the health sector, this parliament needs to begin to look into the welfare of the VHTs, because the VHTs do a lot of work. Every health exercise that should succeed, if you do not involve the VHTs, many times it does not succeed very well. When you are distributing net, when you are giving drugs in the villages, this parliament should consider helping the VHTs in improving the health services. Thank you very much.
Thank you. Honourable Wachkona.
Thank you, Right Honourable Speaker. And I'd like to thank the mover of the motion. Oh. The mask. But this is what we have been talking about masks, yes, and about pressure. You warned us in the speech before we started talking. But now, I would like to bring a little example of something I've handled in my life: aviation medicine. I was recruited as a pilot. I went through all the medicals required, and all my friends, we went together through all those medicals. But medicine was not emphasized. Behavior was heavier than medicine. All the ECGs they were giving us, if you reached 40 years, you would go back to be checked. And after 40, the check would last only 3 months, and you go back again for medical. And the people remained normal. Even me now, I'm 72, I'm normal. And what happens now is that even the medicine which we're arguing, the move of the motion urged the people to do, is that the other day they were giving HIV medicines to people in my place, Bududa there. And then one of because he was a senior person in the system, said, for me, I want the strongest. They gave that person a strongest dose. And now that person cannot look at you straight like this. He has to do this before he sees you. He has to look up, and then he's looking at you. He will communicate with you. So this education of how you treat people is very important. Somebody talked about water. Yes. For me, if you didn't have water, for example, of a certain level, if you didn't take the amount required, and you reached the airport, and water system or pressures were at a certain level, they would say, no flight for you. You're a pilot, go back home, rest and take so many bottles of water. And after checking the disease, you will not find any disease. The behavior is very important, and I propose to the move of the motion to also include that system where people are checked, but you know, checking here is, as an honorable member said, is very expensive, but we must follow it and then see how we keep moving the way we are. Thank you very much, Right Honorable Speaker.
Butamala.
Thank you so much, Right Honorable Speaker. I would love to say, first of all, Mr. Speaker, thank you so much for allowing us to learn on job, because the induction probably we got was not sufficient. I rise under Rule 61. Right Honorable Speaker, I have a mother who is diabetic, and because of that, I am trying to do good research in the area of diabetes. And I have read, and I'm still continuing to read that book, that diabetes has nothing to do with diet, has nothing to do with the genetics, nor with exercises. I have a cancer patient that was almost condemned by the Cancer Institute, and we have decided to choose to take alternative methods of treating this person, and is now improving. And having listened to colleagues, Right Honorable Speaker, there are many other diseases we would think we need to take care of. Like colleagues have said, non-communicable diseases. For that matter, therefore, Right Honorable Speaker, allow me amend the motion.
Propose an amendment.
I propose, allow me to propose the amendment, and I thank Honorable Nkunda for proposing this motion. I am proposing that we urge government to prioritize investment in non-communicable diseases so as to provide free drugs to Ugandans suffering from them, and do research in those areas in order to find local solutions to them. Right Honorable Speaker, whereas we are patients, we are also customers and clients to some pharmaceuticals somewhere. It is important that we do research in these areas, and there are many Ugandans willing to do research in these areas and provide solutions, and probably have not been supported enough. As we urge government to give free drugs, a matter that I support, I also propose that we add in doing extensive research in those areas so that we can eventually find local solutions to those problems. I beg to move, Mr. Speaker.
Would the presumption be that government departments are not doing research in this matter? That would be the presumption, but I don't think it would be a proper presumption, because there are whole research departments of government dealing with these things on a daily basis. So, but we can put it there.
Mr. Speaker, the word I used is prioritize. I didn't say they don't do enough, but we urge government to prioritize investment in that area.
I'm just trying to assist here. And I'm just trying to assist here. Honourable members, that is a proposal for the amendment, that the subject of the motion be altered a little to accommodate more broader concepts and also emphasize research in finding solutions to this. Is that proposal seconded? It's seconded by Shema, Professor Mushemeza, the Honorable Colonel Dr. Nekesa, member for Bueju, member for Manjia, Bugiri Municipality, Ngora, workers, Butaleja, is that Butaleja? Honorable member for Bueju, Zombo, the MP, okay. Zimbabwe, the pastor. Okay. Does this motion require speech? No. It doesn't require. I think it's straightforward. The discussions have indicated that we don't need it to restrict it to diabetes and blood pressure, because there are things around it that are similar that you might need to pay attention to. Yes, move of the motion. Are you comfortable with this? You have to be on record, madam. I can see you agreeing, but you need to confirm on the record that you agree to this proposed amendment.
Thank you, Right Honourable Speaker. For the yes, I agree that the government can prioritize to do more research about it, and they find solutions.
And to widen it, not just diabetes and high blood pressure, but also non-communicable diseases generally.
Yes, you're right, Honourable Speaker. I agree.
Okay, that is the amendment proposed, and the move of the motion has no problem to it. Can I propose this amendment now for your decision? Then we move on the subject of the motion in the terms proposed by a member for Butambala District. I put the question to that amendment. Those in favor say aye, to the contrary, no. The ayes have it. Debate continues. Now you are debating the amended motion. Had already picked Marcin.
Thank you very much, Right Honourable Speaker. Yesterday I stood as a sociologist. Today I stand as a Rotarian. I thank the mover of the motion, amended. Thanks so much for this motion, because health is wealth, and we want every Ugandan to be healthy. I wish to raise the issue of awareness raising. As a Rotarian, we used to have health camps. Unfortunately, Right Honourable Speaker, of course because of COVID, but now we are moving out of COVID soon, hopefully. These health camps used to help a lot in making awareness on a number of issues. And indeed, many people used to turn up. We'd have different sections for awareness and also for treatment. And I want to thank this Parliament for the support they have given to Rotary. Recently, we had the President here, and thank you for the rousing welcome you accorded him. So health camps should be encouraged, but under Ministry of Health guidance. Right Honourable Speaker, we always go to our radio stations to talk about many things. And the RDCs have been informed, I was informed that they have airtime, free airtime on all radio stations. And this airtime is supposed also to be shared with some of us. If it is not enough, we were asking that more airtime should be given. The minister in charge of ICT should help us with that. What am I trying to drive at? Awareness raising. Let us have a number of these technical people in the studios. The medical officers, the DHOs, we go together and we choose on particular diseases to talk about, so that our people are aware of the dangers of these diseases. Right Honourable Speaker, I also want to propose that the government provides some of these simple machines for testing pressure and diabetes. I don't know how much they cost. If the MPs maybe, if they are very expensive, we can try to also to help, because the issue is we don't know that we are suffering from pressure or diabetes. Means of health is on the order paper, Right Honourable Speaker. The minister, I think, will soon come to tell us about the situation of health. And I remember you telling us that she'll be coming. So we shall raise some of these issues when she comes. And therefore, I stand to support the motion, and that motion which has already been amended, and they still insist that let us go to the radios, talk about health, because health is wealth. Thank you, Right Honorable Speaker.
Thank you very much, Honorable Member for Masindi District. Honorable members, today there is a motion that is not reflected on the order paper. It was supposed to have been presented by the Honorable Martin Ojara Mapenduzi, but we did not receive the text of the motion in time, so we could not put it on the order paper. The subject matter of this motion attracts the attention of two young people, Mr. Ogwang Moses Adonyo and Mr. Patrick Abila. They're here to observe the proceedings, but what they expected was to be listening to a discussion on the motion to deal with the campaign to abolish nuclear weapons in the world. The Honorable Mr. Ogwang Moses Adonyo is the country coordinator for the United Nations international campaign to abolish nuclear weapons. And Mr. Patrick Abila is the Director of Operations at Makerere University Private Sector Forum. These two are interested in this matter, so they were here, but I think now we'll handle this motion next week when the text is made available. But you're very welcome to follow the discussions on these other matters, and then next week we might have your matter on the order paper. Thank you very much. Dora?
Thank you very much, Mr. Speaker, and I want to thank the Honourable Member Kanungu District for moving this motion. The motion is urging government to provide free medicine to people who are suffering from non-communicable diseases, as now amended by the Honourable Member on the other side of the House. And ideally, government supports this motion because, honourable colleagues, these are the issues affecting our people in our constituencies. So this is a value-adding motion, and we do support it. I also want to thank the members who have talked about the other side of the motion. Treatment normally comes at the tail end. But the big work that we have as members of parliament and as leaders in this country is prevention. And prevention, as many members have said, starts with us as leaders by giving example. Mr. Speaker, we have done a very fantastic job in this fight against COVID because every member of parliament has gone out, every leader, beginning with the President Yoweri Museveni, gone out to talk about the dangers of COVID. As the honorable member from Masindi, and I think Honorable Muma talked about the radios, we have 1 hour every week, free 1 hour as government, available to talk about programs of government and any other issue. And I think members, despite your political party, if you can use this 1 hour with our system of RDCs to talk about non-communicable diseases, the dangers of non-communicable diseases, I think you can make a difference. Everywhere you are in the constituency, like we have been talking about COVID, we can use every opportunity to talk about non-communicable diseases, especially the preventive side of it, which is what you eat, what you think about. Mr. Speaker, this morning, in part of the fellowship of Thursday, we were talking about worries, including ourselves here. There could be even some members who have already started being worried about the next term. It is 4 years from now, but you are worried. This causes pressure, causes stress. Others are worrying about the 5th term when actually they are in the 1st term. So the way we behave, so being example, I think is a very, very important point. So we can talk about these issues in our constituencies, make it a habit, be determined to talk about them, and I know every time leaders have got involved in fighting a disease, we have won. And I think non-communicable diseases, the cost of non-communicable disease is increasing every year, is a danger to our families, is a danger to our country, and as leaders, we must join hands together to fight non-communicable diseases. So one part of the story is medicine, but the big part is prevention, and it starts with us. So, Mr. Speaker, I want to thank, I just stood as a member of the executive to say that the honorable member and members of this House are actually preaching to the converted. So we welcome the urging and we'll follow up and make sure that these views that we have received here inform our policy formulation as executive. Thank you very much.
After that speech, I was getting very tempted to close the debate. But since the members who still want to express, I'll have Manjia, I'll have the, can I first finish the list? I'll have the honorable member from Manjia, the honorable Major Dr. Alanyo, the honorable member for Buheju, that is the honorable Francis Mwejuchi, and then I think I'll close. Okay, let me first do this, then we see how to proceed. Okay, let's start with the honorable member for Manjia.
Thank you, Right Honorable Speaker. This is a crucial motion, and I support it, including the amendment, Mr. Speaker, sir. I went through the health reports, healthcare reports, including those of the World Health Organization. 74% of the disease burden we have in Uganda is preventable, including diabetes and high blood pressure. Mr. Speaker, some genius said that many a human being dig their grave using teeth, discuss. Indeed, it is true, Mr. Speaker, if you dissected that phrase. We eat foods, junk foods, chips, cookies, sodas. There are drinks, Mr. Speaker, sir, even during campaigns, I was a victim of one of the drinks. We have to be very careful, members. Even if you look at the level carefully of these drinks, on those levels, they hide the facts. They don't tell you the ingredients that are in the drink. Mr. Speaker, some of the drinks, I don't want to mention the names of some of these drinks, but you end up taking Viagra of sorts. You only realize at night, Mr. Speaker, that you are not behaving as usual. And also, it may anyway engage you in exercises, which may also help to tone down.
For the future readers of the Hansard, would you like to be clearer on what you're saying, please?
Mr. Speaker, I'm talking about drinks, new drinks, fresh drinks that are on the market. We have drinks like Rocco Boom, and many other Mukamana Yamba. If you read the label, it is talking about very deceptive statement, like it is very nutritive. You will think you are having, they even put their diet drink, that you are having a complete diet. In the actual fact, it is actually stamina of sorts, actually Viagra. Mr. Speaker, the food we choose is very important. I concur with my sister from Butambala that in her research she has been reading, and she realizes that diabetes is not caused because of the foods we eat. But if you read also further in some scientific journals, if you are to manage your sugar levels, if it is high, you are advised not to eat foods that are rich in sugars. And if it is low, it is the opposite. So these are all conspiracies, scientific conspiracies that require further research. Mr. Speaker, when the foods we get in the supermarkets these days, you have to know the ingredients that are in those packaged foods, or else you end up with junk foods, which will increase your sugar levels or even blood pressure. What is very important is also to exercise, not necessarily that we have to be like the Honorable Vassalira says, that we have to be in the football pitches or running along the streets, but there are also good indoor exercises, including sex, Mr. Speaker, sir. Mr. Speaker, I am a biology teacher, and I see no vulgarity in this. I'm not being obscene, but this is a fact. You should, as members who may be active in that area, you should not abdicate your responsibility, because it is one stone for two birds. As you fulfill your conjugal rights, you are also exercising to reduce on some of these non-communicable diseases. Mr. Speaker, sir.
Order.
Mr. Speaker. Mr. Speaker.
Point of order.
Procedure.
Point of order now, procedure?
Yeah, I think it's order first.
Point of order.
Right, Honorable Speaker. We are aware that the activities of this House are public, and we're on air in all the sitting rooms of most homes in this country. We have children who are seated watching us, discussing what's happening at this level. Is this in order for the previous speaker to use the kind of language that he has used, that leaves our children wondering what we're discussing without providing the right environment to explain what he's trying to communicate? It's in order. I submit.
Thank you very much. Honorable members, each time we discuss matters in this House and the kind of words that we use, we should always remember that this is the August Assembly and it's televised live. Yesterday we had a motion on some of these issues and was debated very, very widely. It is not a biology conference. It's not a scientific symposium. It is a sitting of the Parliament of the Republic of Uganda. Let's accord it that respect. You can go and use some of those words in your private meetings, which are unrestricted. Okay? Please.
Most obliged, Mr. Speaker. But in our curriculum, you would appreciate that one of the subjects.
Proceed.
As I proceed, Mr. Speaker, sir, much as we urge government to provide free healthcare services and drugs to patients or victims of diabetes and high blood pressure, Mr. Speaker, we should actually also urge government to give free airtime to health workers or even leaders to promote or increase levels of awareness through preventive, promotive, palliative and curative lessons.
Are you talking about airtime on phones or
airtime on electronic media, Mr. Speaker, sir? And it would be good. It shouldn't be a preserve of the RDCs, but this should be an exercise that should be conducted by technical officers like healthcare workers. As I conclude, Mr. Speaker, in my research, as I'm actually deep in research, Mr. Speaker, sir, these diseases you need a lot of enough sleep. Sleep is also a therapy of sorts. And I concluded that I beg to submit.
Thank you very much. Honorable members, we should prepare to close with the following members speaking. I'd already picked the Honorable Major Dr. Alanyo, then Bueju, then I'll conclude with Lira. And then we close, so that we prepare for Prime Minister's question time. But I wanted to see if I could handle the motion for leave, which would be a short motion for members to allow the member to proceed to prepare private members. Yes, Honorable.
Thank you. Right Honorable Speaker, sir. Major Dr. Jennifer Alanyo, representative of UPDF. The Right Honorable Speaker, sir, for purposes of record, I've already said my names. I would like to request to tell you this. Congratulations upon your victory, sir. And congratulations to all the members of Parliament who made it here. This being my maiden contribution, allow me support the motion of government to provide free diabetic drugs and hypertensive drugs. The Right Honorable Speaker, sir, services of provision of free testing of diabetes and testing of blood pressure has been going on in many government hospitals, right from health center 2 and above, except sometimes there are breakages of machines here and there, inadequate supplies. That has been a problem. And in that vein, we shall require the government to improve on supplies, funding, and above all, creating awareness through the forums and sensitization, just like they have been doing for hepatitis B. Many people flock in hospitals to come and test for other things, including hepatitis B. We should include that, so that the test is very simple. It takes less than 20 minutes, and you would have known your glucose level and then how your pressure is. Many of my colleagues have talked about diabetes affecting the young. Diabetes has a lot of, we have many types. There are those that affect the young indeed, those who are below 40 years. One of my colleagues said he saw a child who was 12 years. The youngest patient I've ever treated actually was 7 years of age. So you can imagine the gravity of cost starting to treat a child of 7 years on insulin and for life. Indeed, that is where government should come in and reinforce the health sector system and give those drugs really to be free. Diabetes has a lot of complications. From the medical perspective, high blood pressure is one of the complications of diabetes. That's why every time you go to the hospital to check for your glucose level, request for your blood pressure checked. And it is not only limited to high blood pressure as a complication. There is kidney failure, there is blindness, name it. So every time we talk about provision of drugs, yes, what about the complications? They're enormous. So all this should be encompassed as management and treatment of diabetes and hypertension. Right Honorable Speaker, sir, in conclusion, testing kit can be reinforced in many health centers, as it has always been. They need to beef up. And also increase of funds. Drugs have always been there, except not enough, because numbers of patients have gone up. But as a practicing medical doctor, while out of Parliament, we see a lot of patients. The number has really gone up. So the urge is that the government should increase on supplies, including funds. Right Honorable Speaker, I beg to submit and thank you for the opportunity.
Very welcome.
Thank you so much, Right Honorable Speaker. Right Honorable Speaker, I will not speak as the doctor, as insinuated by Okupa.
But are you?
I am going to speak as a representative of the people of Buhweju. Mr. Speaker, I support the motion. As an interested person, every time a person goes to Nsika Health Center or any health center in Buhweju and there's no medicine, they will call me. They will call me to provide medicine or to provide transport to where they can access medicine. So I support this motion so that the burden to me is reduced. But two, I have become like an in charge of health centers. I am a doctor. I am a minister of health. Because everything, health, if it's not there, then they have to look for me. So a motion where my burden is going to be reduced, I have an option, but support it. But two, Right Honorable Speaker, is to thank the members, colleagues, for the spirit that is developing in this House, where a motion is brought by a member of the other side and is supported across board. I see it coming, and I want to support you, Honorable Kanungu, but I also want to thank you, the other side, for supporting the amendment of our colleague from Butambara. Thank you very much, Right Honorable Speaker, and the people of Buhweju are very happy now that the medicine is going to come.
Lira.
Thank you so much, the Right Honorable Speaker. For the record, I'm Auma Linda Agnes, the woman MP of Lira District. I rise up to support the motion as amended for the free service that will be given to our people, especially the diabetic ones and those who have high blood pressure. Right Honorable Speaker, as my colleagues were giving their submission, I made some observation since there's increase in these illnesses. My observation is on the preventive measures, especially on the signs and symptoms of these sicknesses, which should be a serious emphasis, both through awareness by the leaders and even the medical personnel. Most of the people who get these sicknesses, they realize when it's too late. And others, on realizing, they would be at their death point because of ignorance on the signs. Yet the sicknesses would be showing signs, but they were not knowing. I feel that even if we are giving free medicine to these victims of these illnesses, we should help them earlier in knowing the signs and symptoms so that they go for treatment early other than late. I have very many people who realize, especially about pressure, realized earlier, and they followed what the doctor told them. They are now free from their sicknesses. So if we do this, it will help our people, because I know COVID have caused a lot of impact. People are stressed, people are depressed. The number of the people that will have these sicknesses will increase, and it will overwhelm the government. So it's better we prevent it earlier. Thank you so much.
Thank you very much. Member for, it is Bushenyi?
Ruhinda North County.
Ruhinda North.
Thank you, Right Honorable Speaker.
But in Bushenyi, of course.
No, Right Honorable Speaker.
In Mitoma.
Yes.
Okay.
A very independent district, Right Honorable. Right Honorable Speaker, I want to start from the point raised by the opposition chief whip, where research shows that indeed 75% of the sick people, of the people in hospitals for treatment in Uganda, are suffering from diseases which are preventable. That means out of 100 people, 75 shouldn't be there. So, and we have focused so much on treatment than prevention. And for such a diseases, you find that even if you're to get treatment, it's for the rest of your life. You have a burden for the rest of your life, you're on treatment. So I want to thank Honorable Nkunda for raising this matter, and also the Honorable Aisha for allowing us to discuss it in a broad manner, which can help us focus on research. We focus on prevention. Sometimes, really, if we could do much. Honorable Nambesha was raising a very important point, though he put in a lot of Rugisu culture. But it's a very big problem, even in our villages. Me, during my campaigns, I was telling people that you drink water from morning to evening, you have just brought a new bride, and then you go to Mukama na Yamba for help. It really can't work. So we have to ensure that we teach our people to be preventive.
Government Chief, you know that the language of this house is English. So we cannot.
God will help me. That's what Mukama na Yamba. You do whatever you do, and then God will help on the rest. Right Honorable Speaker, also the issue of misleading adverts. I used to listen to some misleading adverts saying that Mirinda Fruity is for giving you blood. This one is for doing this. So I think the Uganda Communications Commission as government, we need to come in, we look at these misleading adverts. We be very clear on them. They are misleading very, very many people into consuming very dangerous substances. So this one, I will communicate to the minister in charge of ICT to ensure we follow it up. Right Honorable Speaker, also, we have found government, for now we allocate 2 billion only for drugs, for these very, very dangerous diseases. 2 billion only annually. So colleagues, we participate in the budgeting process. Let's also look at it. Colleagues on the Committee on Health, colleagues on the Committee of Budget, we look at it and we see what best we can do. Because for now, we provide free insulin, we do provide free checkups, but the 2 billion is for the whole country. Each district gets a portion of it. Now you can imagine how much we give to 146 districts in the whole country. So it's an issue we have to look at when we are budgeting, Right Honorable Speaker. Right Honorable Speaker, as I conclude, this is a matter for which we must give serious attention, and I would propose that for now, I've seen on pending business to follow, the Minister of Health has a statement on state of health care service delivery in Uganda and budgetary implications. I'm going to talk to her so that she can update and include responses to issues raised here, that once that statement is presented, issues of NCDs are clearly captured. But also, I will urge her to take this matter to Cabinet so that Cabinet can start looking at NCDs as one of the areas we should focus on as government to help our people. I thank you, Right Honourable Speaker.
I think what you give to the Minister is the motion, as decided. The debate may not help much, but the decision of the House would help guide. Honourable members, we'll put this to a close now. In a few minutes, we'll start Prime Minister's question time, and then we'll see how to continue with other matters after Prime Minister's question time. The question that I now put for your decision is for a motion for resolution of Parliament urging government to prioritize investment in research and treatment of non-communicable diseases and provide free drugs for the treatment of the NCD patients. That is the motion for your decision. I'll put the question to that. Will those in favor try to the contrary? No. The ayes have it. Congratulations, Honourable Member for Kanungu. You picked the right subject and you got the right support. Thank you. Can we We have a motion to support. Today is private members' time. We have a motion to support, for a resolution of Parliament to introduce a private members' bill entitled the Markets Bill. The Honourable Member for Workers will be making this, but we can't start now because just in a few minutes, or you can give it a shot. Honourable Member, Clerk, can you call this item and we see how to...
Item number 6 on the order paper, motion seeking leave of Parliament to introduce a private members' bill entitled the Markets Bill 2021.
Honourable.
Yeah, thank you very much, Right Honourable Speaker. My motion has already been stated. I'm seeking leave of Parliament to introduce a private members' bill entitled the Markets Bill, and it's moved under Article 94, 4B of the Constitution of the Republic of Uganda, and Rules 121(1) and 122(1) of the Rules of Procedure of Parliament. Whereas Article 79 of the Constitution of the Republic of Uganda empowers Parliament to make laws for the peace, order, development, and good governance of Uganda, and whereas Article 94, 4B of the Constitution and Rule 121 of the Rules of Procedure of Parliament grant a member of Parliament the right to move a private member's bill, aware that Article 237(1) of the 1995 Constitution of the Republic of Uganda vests land in the citizens of Uganda, and Article 42 grants every person a right to practice his or her profession and to carry on any lawful occupation, trade, or business. Noting that the current Markets Act, Cap 94, places the establishment, administration, and maintenance of the markets in Uganda solely in the hands of district administration, municipal council, and town council within their area of jurisdiction, recording that at the time the Markets Act was enacted in 1942, Uganda was operating a planned economy where all elements of the economy were determined centrally by the government. Considering that the advent of the liberalized economy buttressed with the enactment of the 1995 Constitution, Ugandans were granted the right to practice their professions and carry on lawful occupation, thereby tendering the restrictions under the current Markets Act in relation to ownership, establishment, and administration of the markets absolute. Appreciating that over time, market vendors, private individuals, and companies have joined the market business to establish and manage markets, convinced that there is need to repeal and replace the Markets Act, Cap 94, to provide for a comprehensive legal framework that is well aligned to the legal and economic reforms that have evolved over time and untimely strengthen the regulation, management, and administration of markets. Now, therefore, be it resolved by Parliament that the House grants me leave to introduce a private member's bill entitled the Markets Bill 2021, a draft of which is therefore thereto attached.
Is the motion seconded? Is the motion seconded? seconded by Yam, the Honorable Bakabulindi, Chigulu South, the Honorable Museveni, member for Kagadi, member for Jumani East, West Moyo, Honorable Nangoli, Kapalebiong. Honorable, I wanted to do this. I'll propose the question just to mark a stage. But if the Prime Minister was going to allow us, we would use, like, I think let's finish with the Prime Minister's question time, then we'll return to this. But honorable members will come to this and propose the question and we'll proceed properly when the member has the time to justify our motion.
Yeah.
Can we pause it there? Motion received, seconded, and then you'll speak to your motion as soon as we finish with this.
Yeah, thank you very much, Right Honourable Speaker and colleagues. Defects in the existing law. The Markets Act, Cap 94.
No. I said you'll do the justification after.
Justification.
Let us finish
At a
with
later
this,
stage.
and then we'll come back to you.
Okay, thank you.
Thank you very much.
Item 5, Prime Minister's time.
Right Honourable.
Right Honourable Speaker and Honourable colleagues, good afternoon.
We have already handled the business for next week, so you go straight to your time.
Thank you, Right Honourable Speaker. Right Honourable Speaker, the Honourable Kaya, Christine Nachimwero, Woman Member of Parliament Chiboga, gave a very long preamble. I will not go through the preamble in the interest of time. But her question now, she had a number of questions, but the question number 1 is, what is the progress of government's promise of offsetting the compensation bill as promised through use of Ruwero Triangle budget for the financial year 2016, 2017, 2018. Honourable Speaker, my response is that my office has been handling the payment of one-off gratuity, akasimo, as it is commonly known, to civilian veterans. As of today, 497,500,000 has already been dispatched to 182 veterans in the Kasejere war zone, and the sum of Uganda shillings 185,500,000 will be included in the financial year 2022-2023 for the remaining 84 veterans, because this financial year's budget has been greatly affected by the COVID-19 pandemic. The second question was what is government's plan of resettling the veterans to their original areas while considering the COVID-19 testing and equipment for those people, including the basic essentials they would use in their long vacated areas. Right Honourable Speaker, my response is that the government has previous occasions extended support towards the veterans. As of 10th May 2016, all veterans who assembled at Kitagenda Primary School in Chiboga district returned to their home after government intervention. There are reports that 25 individuals who were mobilized by some leaders who have again assembled in Rwamata Town Council in Chiboga district. I have directed the Minister for Ruwero Rwenzori Triangle to organize a meeting with the assembled group at Rwamata in conjunction with the district leadership to ascertain their claims. If they are found to be true, then the government will come in and intervene. In regard to COVID-19 testing, Chiboga district, as of today, has received a total, Right Honourable Speaker, of 13,750 vaccines, and there is a vaccination center at Rwamata Health Center 3, I urge all veterans to use the above facility for vaccination. The third question, Right Honorable Speaker, is that how can government advise the district leadership on the actionable practices and the position of government on the political, social, economic challenges in the area? Right Honorable Speaker, in 2016, the NRM government constituted a committee that worked with Chivoga District Local Government and the representatives of the people of Kasejere Zone, and came up with priorities in the service delivery to the people of Kasejere Zone. In that regard, the NRM government has completed the first phase of the Ruamata Water Project, as our colleague is already aware. The second phase is scheduled to start in the fourth quarter of this financial year 2021-2022. Surveys have been completed to construct a seed secondary school in Ruamata under the Uganda Integrated Physical Transfer Program, Phase 3, and also construction of the Kitegenda Ruamata Road is underway. Honorable Speaker, government is committed to extend services to the people of the entire country, Chivoga inclusive. The last question, Right Honorable Speaker, is that what is government's plan of ensuring that the rights of these innocent Ugandans are fulfilled, since many shades of leadership exhausted their effort and have now decided to look on as far as fulfilling the 17th March 2017 presidential pledges to the relevant, those veterans are concerned. Right Honorable Speaker and colleagues, I wish to categorically clarify that during the 17th March 2017 meeting with HE the President, he did not make any pledges to the leaders of the people who had assembled at Kasejere. Honorable colleagues, as usual, the NRM government, as you are aware, will continue to meet its obligations with regard to payment of Kasimo to civilian veterans, including those of Chivoga. Honorable Speaker, I beg to move.
Thank you very much. Those were the questions that were raised by the to the Right Honorable Prime Minister, and the responses thereto. The rules allow the leader of the opposition to make. Are you the leader of the opposition? These days, I'm told you need to show me the instrument, but I'll waive that requirement. Proceed.
Thank you. Right Honorable Speaker, I want to thank the Right Honorable Prime Minister for the responses. But Madam Right Honorable Prime Minister, the compensation, I concur with you that it's being processed. But in this question that she raises, there is that grave concern of the violence, the brutality that was occasioned on these veterans by the police. And then they were actually detained without trial for over 38 hours. And this unlawful action ought to be equally compensated. You have not mentioned the compensation of this unlawful actions by the police. Then in the other response, you make contradictory statements, especially when you say that all veterans who assembled at Kitagenda Primary School in Chivoga returned to their homes after government interventions. Then in paragraph 3, you say, the second paragraph, you say, but there are reports that 25 of them are still in the town council, and you have directed the minister of Luero Rwenzori to convene a meeting. So you see they are still there, so which means there are issues. There is more to it than meets the eye. And lastly, in this last response, I don't know who is being conservative with the truth. Is the member who asked the question not coming out clear, because if you say that His Excellency the President on that fateful day of 17th of March 2017 never made any pledges to the leaders, and is actually the salient question that is being raised by the member, that the President committed himself, he pledged, he has not honored the pledges. Now, who of the two is being conservative with the truth? I leave it to you, Right Honorable Prime Minister. One of you must be telling the truth, one is conservative.
Thank you very much. The leader of the opposition, I think what you have just done would have extended this debate, because you have asked questions again to the Prime Minister, questions to which he should have responded. I think the purpose for response, and that's why there's a time given for it, the purpose for your reply is to restate a few things and tell this House what you would have done differently, not ask questions. We assume you are government in waiting. So, but from the way you're proceeding, looks like you enjoy being in the opposition very much. Thank you very much. We have sufficient time now to go back to the other matter. Thank you, Right Honorable Prime Minister, for these questions. The next time I'm going to ask you to be able to take one or two comments from members and then you engage with them. But not today, next time. Thank you. Yes, can we go back to the motion?
Yeah, thank you very much, Right Honourable Speaker. Allow me to start with the policy and principles. The object of the bill is to reform the law relating to the establishment and control of the markets in Uganda, to provide for the establishment and management of public and private markets, to provide for licensing of the private markets, to provide for registration of markets and vendors, to provide for levying and collecting of markets fees, to repeal the Markets Act Cap 94 and for related matters. The defects in the existing law: the Markets Act Cap 94 does not address the current needs of market development, management, and administration that have evolved over time. The current Markets Act places the establishment and administration of markets solely in the hands of government. Section 1 of the Markets Act, for example, prohibits any other person or authority other than district administration, a municipal council, and town council within their jurisdiction from establishing and maintaining a market. This legal regime was based on the economic structure at the time, during which period Uganda operated a planned economy where all elements of the economy were determined centrally by the government. However, with the advent of the liberalized economy, buttressed with the 1995 Constitution of the Republic of Uganda, Ugandans were granted the right to practice their professions and to carry on lawful occupation, trade, or business. As a result of the economic and legal reforms that have evolved over time, there is need to align the regulation of markets. Section 2 of the Markets Act empowers the minister to make rules and bylaws for carrying into effect the purposes of the Act. The Act, however, does not define or specify the responsible minister. When the Markets Act was enacted in 1942, Uganda was a centralized system of government. Uganda had a centralized system of governance. It was therefore presumably, the minister responsible for trade was responsible for handling matters relating to the markets. However, When the decentralized system of governance was introduced, the minister responsible for local governments took over the governance of the local government's affairs, under which the market's operations fall. Hence, the need to align the law to the changes in policy. Kampala Capital City Act 2010 mandates Kampala Capital City Authority to establish markets within the capital city and devolved the administration of markets to division urban councils. Given that the capital city had a separate ministry responsible for its affairs different from that of local governments, there is need to cater for the administrative uniqueness of KCCA and facilitate collaboration of the two ministries to ensure coordinated implementation of markets regulation. The Markets Act does not provide for management of vendors, including involvement of vendors in the affairs of the markets and vendors registration. In addition, the Act does not make provision for determination of markets fees and revenue collection. The absence of a regularized modalities on management of vendors, revenue determination and collection has resulted in an unending conflict between market operators and vendors. There is therefore need for a law that will facilitate streamlined market operations. Over time, there have been changes in the administration structures of local governments, which were not envisaged in the current law. The elevation of some districts to cities, for example, necessitates a legislation that will facilitate the establishment of well-regulated, organized modern markets that match the intended level of modernization and development of the cities. Remedies proposed by the bill seeks to provide for a comprehensive legal framework to strengthen the regulation, management, and administration of markets, and to repeal and replace the Markets Act, Cap 94, to address the gaps and the limitations that have been identified in the current law. Right Honourable Speaker, I beg to lay on table a copy.
Let the records capture that. Thank you very much, Honourable. I will ask for secondment and then propose a question for debate. But what we need to bear in mind, it is within the members' right under the Constitution to propose private members' bill. This procedure we created to help us ventilate the proposals and make sure the proposal being made does not violate other provisions of the Constitution or cause conflict. One such provision is Article 93, where we say, well, a private member is not allowed to propose laws or motions that would impose a charge on the fund without the consent of government. That is specific to private members. And then there are the general restrictions for everybody who wants to propose a law, including government, to try and legalize things that are part of the rights that you cannot derogate from under the Constitution. Those are restrictions which are there. You cannot propose a law that will create a one-party state. That one, everybody is prohibited from making such attempts. So those are the only restrictions on the right of a member to propose a private member's bill. So usually we consider this a formality, that we just look at the thing, look at the proposal, see if it doesn't violate anything, and normally we grant members the leave to proceed with their proposals until they are processed and finalized. So the purpose of this debate is not the substance of the bill, but the need for it. The need for it in a sense that there are gaps that the members said have been identified, and looks like the government chief whip has not had, and his team have not had time to reflect on this matter and look at it as an urgent matter. So a private member now wants to deal with that matter, to deal with those gaps that are created. Are we together on this? So the question that I now propose for your debate, and thereafter the seconders will speak, is that the honorable member, the Honorable Rogshaja Margaret, MP Workers Representative, be granted leave of this House to introduce a private member's bill entitled the Market Bill. That is the motion for your debate, and the debate will start from the listed people who are supposed to be seconding the bill, and then we'll proceed from there. I'll have another Workers MP, the Honorable Kunihira Agnes, to give her first speech, and then we go to the other seconders. Honorable, please let's limit the time, so if it is necessary, other members can also participate in the debate.
Thank you, Right Honorable Speaker. I'm Agnes Kunihira, MP representing workers. Right Honorable Speaker, I stand here to support the motion, to support the Honorable colleague to take leave to introduce a private member's bill entitled the Markets Bill 2020. Right Honorable Speaker, as you have heard from the mover, the current Market Act was established in 1942. It is over 80 years now since that time, and there has been a lot of changes. One of them is the population growth and the new developments. Currently, individuals have established markets, yet from the current law, a private individual is not supposed to run a market. The new law now will have helped the individuals who are investing in markets to be able to operate legally, unlike now when they are operating outside the law. Right Honorable Speaker, the current law also does not provide for the vendors, the individuals who are operating in the markets, the companies that carry out a lot of issues like management and control of markets and providing services like security and others, even revenue collection. Right Honorable Speaker, you're also aware that government has put in place a number of public markets. The law needs to be harmonized. The markets law must be harmonized with the Local Government Act to ensure that these markets are well managed and everything runs smoothly. You're also aware that currently there are a lot of fights even between the urban centers like Kampala State Authority with the individuals who had already been leased like Nakasero Market and Owino Market. And it is important now that the law is put in place, repealing the 1942 law, as you guided some time back that if you're going to amend the law, if it's more than 50%, then it must be repealed. And that's what the colleague is trying to do. Right Honorable Speaker, what my colleague did not mention, the Markets Bill was among the business that lapsed. Unfortunately for her, she had even been able to secure the certificate of financial implication. And I'm sure the Ministry of Local Government is going to support her again because this law has been long overdue. So the most important thing here is to appeal to members to support the Honorable colleague to be able to present a private member's bill. What she's saying now, she's seeking for our support so that she can take leave of Parliament and come back and present a bill. We are also all looking forward from what is going to come out of what she will present by then, and we have been lucky that we have looked through the draft, and I'm sure the new members are going to help to improve on that draft so that she will come out with a better law. I beg to support. Thank you so much.
Thank you. Thank you. Second, the member for Ruyam District.
Thank you, Right Honorable Speaker. Right Honorable I want to thank you for giving us space to present this motion before the House. Right Honorable Speaker, I want to add my voice that the current Market Act was enacted in 1942. Right Honorable Speaker, that is a very long period of time, and so many things have changed. For example, Right Honorable Speaker, when this act was enacted, it fell under the Ministry of Trade. But with devolution of power, we now have the Ministry of Local Government in place. So there is need for the House to allow the private member come up with this bill to address some of those changes. To Right Honorable Speaker, as we know, there is a number of challenges concerning the markets in this country. One, there are so many existing conflicts in the management and the administration of the markets. The vendors are struggling with the market owners or the service providers or the market authorities. And when you look at the current act, the vendors are nowhere to be given a rightful position, given the fact that the majority of the vendors are women, Right Honorable Speaker. And our economy, Mr. Speaker, is largely run by the private sector and the informal sector. So these requests come at the right time to address some of these challenges. Then, three, Right Honorable Speaker, there are various fees which are being paid, and they are paid and yet they are not backed by the right laws. And also, it provides space for the market authorities to exploit the vendors. That's why probably we are seeing so many conflicts in the markets. So I urge this House and my colleagues, members of Parliament, that we support the private member to take leave and introduce this bill. Finally, Right Honorable Speaker, the issue of the contribution of the markets, and more especially of the women, as far as the informal sector is concerned. Most of at times, we pass here loans, we pass here money, we give money to UDB. But who are the beneficiaries of these monies? Is those businessmen and women who are at the apex of businesses. But what about the women and men who are down there operating as market vendors? So I want to believe that when we come up with a comprehensive legal framework, it will help us to address some of these challenges. I want to thank you, and I urge my colleagues to support this motion, and we grant the private member leave to introduce the private members bill entitled the Markets Bill 2021. I thank you.
Thank you very much. The Honorable Bakabulindi, MP Workers.
Thanks very much, Right Honourable Speaker. And I want to thank my colleagues who have supported the motion and support our colleague for bringing this private members bill. Right Honourable Speaker and honourable members, as it has been rightly mentioned, if it was not the collapsing of this permission with the 10th Parliament, all the restrictions were already taken care of. Right Honourable Speaker and the honourable members, if you don't work in the market, and if you don't have a store in the market, at least you have a relative who is having a store in the market. When we're talking about the markets of today, we are not talking about the markets of 1942 or 60s or 70s. We are talking about supermarkets, shopping malls, mobile markets, and hence we're talking about sources of employment to our citizens. You know it very well that the number of graduates in this country cannot be accommodated. The markets of the 60s and 50s were for the old people and the young ones who are afraid to go to the schools. The markets of today include the graduates. So these markets we are talking about to be regulated now have got people who are contributing to the economy of this country enormously. And I think when my colleagues were talking, they want to bring social services closer to the people. And the nature of social services that we're going to get from these markets is not in the same way that the markets were referring to in 1942. Take an example of the COVID-19, when it has just started. The methodologies that we were using to get food items and others, using the market people to deliver to our colleagues, to our homesteads, could not apply in the old fashion. So when we talk about empowering and coming with the new modality and the new bill about the market, we're already seeing ahead what nature of markets we're talking about. We want a law that can even empower our people to own business and be part and parcel of the administration. And this is what my colleague is seeking for. Right Honorable Speaker, when I talk about sanity, some of you stay in Kampala, though you represent different constituencies up country. Of recent, you saw what took place in St. Barikudeb, where a person enters the market, well guarded, bulldozers, then after about a few months, same person removed from the office with guns because of lack of the law. KCC comes in, he doesn't know who is the rightful owner, either it is government or the people. People are leased, but they are not leased. I think it's high time that we bring sanity, not only in the city, but all over the country. When we are talking about this new law, we are not talking about Nakasero and St. Barikudem and the rest in Kampala. We are talking about markets in the whole country. None of us who is here cannot say markets in their districts are not contributing to the employment of their people. They are doing so and aware of. What they need is to be guided. How do they operate? Because they are contributing a lot to the economy. They are contributing a lot to the economy. And we are here because the markets are going on well. And that's why people, including the senior citizens, rich guys, you find them involved in the market because there is business there. So it's a time, and I think it's right to come and regulate. And if you look at the year 1942, what sort of law can govern the current society now of 2021? I was telling my colleagues as a representative of the workers that when I had just got a job, the MD of Uganda Breweries had a driver, had a secretary, had a tea girl, and a copy typist. The current MD in the corporate world is alone in the office. He uses a computer, he sends messages, he drives himself. The former messenger of the MD's office was a P7 lever. Now even the senior 4 lever cannot be a messenger. That's how modern we are moving. So when we are talking about markets, we are not talking about a word market alone. As I've said, there are supermarkets, there are mobile markets now, moving around. Some people have resorted even to using their vans as markets. So we need to regulate. Who should learn what? How should they be protected? Because they are not protected. If they are not protected, they are going to be a danger to the society. Without talking much, Right Honorable Speaker, I want to encourage my colleagues that all the adults concerned with this permission had already been cleared. We are now formalizing. We just need your support so that workers of this country can move with their heads up, knowing that whatever they are doing, they are being guarded by current laws and being regulated. I beg to move.
The Honorable Charles Bakabulindi. Honorable members, usually in a debate of this nature, we don't go as if we are beginning to debate the principles of the bill itself now, because we still don't have a bill. But the entire motion, the mover and the mover did very well, and the seconders did well, because what we are supposed to be doing is these proposals from the private member. Does it cure any problem? Will it, if we grant the member leave will the proposal cure anything that is a problem now? So the debate would be, yes, there are gaps. The current law has gaps. Like the honorable member said, the gaps are so many that if we are to just amend, it will overwhelm the original law, so we might have to what? Take it out and put a new one. That is the line of the debate. That it's not about age of the law. I know of a law that was enacted thousands of years ago, the Ten Commandments. I also know of a law that was introduced by a man called Jesus Christ in the New Testament over 2,000 years ago. Up to now, we have not had occasion to amend any of those laws. So really, it's not about the age of the law, Honorable Bakabolindi. Let's just say the substance. Let's speak to the substance. That yes, these gaps will be cured if we allow the honorable member to present this bill. And two, it does not violate the Constitution. So let's grant the member the right to do so. So if I'm going to allow the debate, please don't start debating the principles of a bill that are not yet here. That is not yet here. Are we together? So are we going to have a short debate? Or should we conclude this matter, grant the member the right, and move on? The right for a private member to move a private member's bill is a constitutional right. Are we agreed on that? The question is, has the member established sufficient evidence to show that there are gaps that need to be fixed? And are we persuaded that our proposal will not offend any provision of the Constitution? So if we agreed on this, what are we going to debate? Can I put the question, honorable members? Honorable members, the motion that I now propose for your decision is that the Honorable Robushaiza Margaret, MP Workers, be granted leave of this House to introduce a private member's bill entitled the Markets Bill. That's a question I put for your decision. Will those in favor say aye? To the contrary, no. The ayes have it. Honorable member, you have the right to proceed. Clerk, you know what to do. It's no longer the duty of the member to proceed with the drafting. You take over. The support of government is required under the Constitution to support the member in the drafting and finalization of this law for further management by this House when it is done. Honorable members, this House is adjourned to Tuesday at 2 o'clock.